region that is Western Greece. Hara, over to you.
Yes, hello everyone. My name is Hara Pilarinu. I represent Doctors Hello ecosystem. Briefly, Doctors Hello ecosystem is a broader ecosystem focusing on healthcare services provision. In our region, Western Greece, we try to integrate several collaborators and interested stakeholders in the broader healthcare sector, starting from SMEs, but mainly academics and research centers and research labs from University of Patras, mainly coming from the medical school and computer engineering school, where we try to merge solutions and promote these to real market conditions. In this effort, we collaborate with existing hospitals in our region, in Western Greece region, having already active collaboration with 5 hospitals. That was an effort through this effort, actually, we had not just some challenges identified. One of them, one primary challenge had to do with the need to control the admissions, not only to control the flow of the patients before the admissions, but also after they leave the hospital, when the care services and the treatment is not completed. So outpatients monitoring is needed, especially for post-operative cases. That was the case. That was the case with the General Hospital of Pyrgos. General Hospital of Pyrgos is a general hospital situated in the capital city of Prefecture of Ilias, city of Pyrgos. It serves more than 150,000 citizens in the area. It's not the largest city or the largest hospital in the region of Western Greece, but one of those, I would say, one of these hospitals to face the more challenges in terms of care delivery. There is a great staff shortage there. Staff shortage that struggles with basic shifts coverage. So the idea was to try to support this hospital with a technological solution that may assist, to some extent, of course, that may assist the control of admissions before coming to the hospital, and especially those that leave urgently the hospital without being fully treated through continuous monitoring. That was the most basic need that was expressed by General Hospital of Pyrgos. And since I've already started talking about the main problem and the solution, thank you very much for switching the screenshots. I'm just coming back again to the current problem. There's a big number of admissions waiting to the big number of waiting lists and admissions waiting before entering the hospital, which cannot easily be handled. I understand that this is a case due to general staff shortages everywhere, but the problem becomes more obscure. It's even larger in remote hospitals. I mean, General Hospital of Pyrgos is not really remote, but it's not a big city, it's understaffed. And as a consequence, it does not properly service the visitors, the patients who come in. The idea was to introduce this solution, TRIME as we called, which is a multi-stage monitoring triage at home. Usually, when speaking about triage, we all know it's something that we usually support before a patient comes into the hospital. The idea is to break this into 3 steps. have an earlier, a pre-step triage before someone goes to the hospital. So we can have a very early assessment. Of what the situation is, then have a more typical standard triage at the hospital, and put the emphasis and emphasize on the outpatient monitoring, kind of shifting the triage after the admission of the patient, so they can continue being monitored once, as we say, they go home, but they have not totally recovered. That usually applies to cases, to post-operative cases, especially to cardiovascular cases. We work on this, we support clinicians and academics in the University Hospital of Rio with post-operative for patients for cardiothoracic surgeries. But there is an apparent need also to other general hospitals who need to continue monitoring the patients. So this is the main problem we're trying to resolve. The expected solution, what we try in collaboration with an SME to work on, is on a system that can provide in real time telemetry data for the clinicians, for the doctors to monitor, and be able, as I said, in real time to give advice, to give treatment, whatever is needed through a collaborative system, through a collaborative session that counts on telemetry, so they can get real diagnosis to support the treatment for those patients after leaving the hospital. The KPIs, I don't know if they're a bit optimistic, we try to keep it as low as possible, but throughout this whole course of the project, 12 months, what the duration might be. Our target is to record to have some records before starting the solution, so we can monitor what is the timing to treatment, what are the cases that have not been properly managed, and then hopefully through the implementation of our solution, be able to record improvement in waiting times, in recovery in patients who have properly recovered, in cases that have been avoided through the monitoring via the system and would not be otherwise. That is the main, I hope I didn't take much of your time, that is the main solution we expect the selected SME to co-create and implement, focusing on two key aspects: the real-time telemetry and the consistency to assist through the course of the implementation of the solution, the doctors in the hospital to properly apply and implement the solution. Thank you very much. Thank you very much for your time.